Assalamu alaikum dear doctors. In this video, I'm sharing information about how to approach to a pink child and blue child. So, if in a CVS station we find a pink child, then we think that the child is breathless or not breathless. If a pink child and breathless, then significant left to right shunt from VSD, ASD, PDA and AVSD. If a pink child with not breathless, then we can think that small left to right shunt, that is VSD, ASD, PDA, coarctation of aorta, pulmonary stenosis and aortic stenosis. Now, if the pink child and median sternotomy scar plus no murmur, then we think VSD, ASD, AVSD repaired and TGA post arterial switch. If the pink child with median sternotomy scar plus pulmonary stenosis murmur plus minus pulmonary regurgitation murmur, then we think number 1 TOF post-corrective surgery with remnants of pulmonary stenosis plus minus pulmonary regurgitation, and number 2 pulmonary stenosis post-surgical valvuloplasty with remnants of pulmonary stenosis plus minus pulmonary regurgitation. Now, if the child is pink with lateral thoracotomy plus median sternotomy scar plus pulmonary stenosis murmur plus minus pulmonary regurgitation, then we think not likely to be pulmonary stenosis only. Then it can be large VSD plus pulmonary atresia bending, or large PDA plus pulmonary atresia bending, or large ASD plus pulmonary atresia bending, TOF post 2-stage corrective surgery, complex heart more than equal or to pathology with residual pulmonary stenosis or pulmonary regurgitation. Now, how can we approach to a blue child? So, if a CVS station we find a blue child on examination, then that is cyanosed child. We again devised this cyanosed child is that breathless or not breathless. If the cyanosed child is breathless, then we can think total anomalous pulmonary venous drainage, truncus arteriosus, TGA plus VSD or PDA, AVSD and single ventricle. If the cyanosed child is without breathless, then we can think TOF, tricapsid atresia, pulmonary atresia or intact ventricular septum, PA or VSD or PDA plus minor collaterals. Note, collaterals are abnormal arterial connections direct from aorta to pulmonary circulation. Now, if the child is cyanosed with number 1 lateral thoracotomy scar plus Blalock-Toshing shunt murmur, then the possibilities are number 1 TOF with pulmonary stenosis murmur, number 2 pulmonary atresia or intact ventricular septum with single S2 plus minus pansystolic murmur or continuous murmur from collaterals. Number 3 is pulmonary atresia or VSD plus collaterals with single S2 plus minus pulmonary pansystolic murmur or continuous murmur. Number 4 is tricapsid atresia, and number 5 Epstein anomaly with tricapsid regurgitation murmur, pulsatile liver and cardiomegaly. Now, if the child is cyanosed with lateral thoracotomy scar plus median sternotomy scar, then the possibilities are number 1 pulmonary atresia or intact ventricular septum, number 2 pulmonary atresia or VSD plus collaterals, number 3 tricapsid atresia, number 4 Epstein anomaly. Epstein anomaly that is operated with Blalock-Toshing shunt later on closed and had proceeded with Fontar or Glenn operation. Now, if the child is cyanosed with no scar, there is no scar but cyanosis, the possibilities are number 1 TOF with pulmonary stenosis murmur, number 2 TGA plus VSD or ASD or PDA might be breathless, number 3 pulmonary atresia or VSD plus collaterals might be breathless, number 4 AVSD especially if Down syndrome might be breathless, number 5 total anomalous pulmonary venous drainage might be breathless, number 6 truncus arteriosus, number 7 Asian-Menger syndrome, that is teenager with pulmonary hypertension. So this is the approach to a pink child and blue child.